Hello, everyone. My name is Linda, and you're welcome to the Wellness Clinic. As we all know, October is a Breast Cancer Awareness Month, and I'm here to share with you some insight on what breast cancer is, causes of breast cancer, risk factors, signs and symptoms of breast cancer, and also how to manage and treat breast cancer. What is breast cancer? Breast cancer is the abnormal growth of cells lining the lobules and ducts of the breast. These cells grow uncontrollably and spread to other parts of the body when not treated. Both men and women can develop breast cancer, though it's uncommon in men. What are the signs and symptoms of breast cancer? There's lump in the breast or armpits. There's breast dimpling or the skin texture of the breast changes. Also, there's pain, an inverted nipple or nipple discharge. There's change in size of the breast and redness and swelling of the breast. Now let's move to the causes of breast cancer. The exact cause of breast cancer is not known yet, but research has said that there are certain risk factors that increases your chance of getting breast cancer. What are some of the risk factors of breast cancer? Approximately 99% of women are at risk of getting breast cancer. 0.5 to 1% of men also are at risk of getting breast cancer, though it's uncommon in men. We have certain factors also that increases your chances of getting breast cancer. So there's age, there's obesity, there's excessive use of alcohol and smoking. And there's also reproductive history, such as the age you menstruate and the age you start your menopause. Research has said that experiencing your menses before the age of 12 increases your risk of getting breast cancer. And also experiencing your menopause after the age of 55 increases your risk of getting breast cancer. And there's also family history, whereby any member of your family, your mother, your sibling, or anybody has died of breast cancer, you're also at risk of getting breast cancer. And there's also certain inherited gene mutations that increases your risk of getting breast cancer. What are the types of breast cancer? We have ductal carcinoma in situ. This is the earliest stage of breast cancer. This breast cancer starts in your ducts and is often curable. If not treated, it can become invasive. There's lobular carcinoma in situ. This breast cancer starts in your milk-producing gland, which is the lobules in the breast. There's invasive ductal carcinoma. This cancer starts in the milk-producing duct and spreads to nearby breast tissues. It breaks through the walls of the duct and invades the fatty tissues of the breast. There's invasive lobular carcinoma. This cancer starts as growth of cells in the milk-producing glands, which is also called the lobules, and spreads to other surrounding tissues or other parts of the body. Less common breast cancer types. There's triple negative breast cancer, there's inflammatory breast cancer, and there's pageant breast cancer. Breast cancer stages are stage 0. With this, the disease is non-invasive, meaning it hasn't spread from your breast duct to other parts of your body. Stage 1. There are cancerous cells in nearby breast tissues. Stage 2. The cancerous cells have formed a tumor or tumors. Stage 3. There's breast cancer in a nearby tissue and lymph nodes. Stage 3 is usually referred to as locally advanced breast cancer. Stage 4. Cancer has spread from your breast to areas like your bone, your liver, your lungs, or your brain. What are the complications of breast cancer? The most significant complication of breast cancer is metastatic breast cancer. With this type of breast cancer, it spreads to other parts of the body, such as the brain, the lungs, the liver, and your bones. Health workers use physical examination and mammograms to diagnose breast cancer. Aside that, there's also breast ultrasound, breast magnetic resonance imaging scan, MRI. There's also breast biopsy. There's also immunohistochemistry tests to check for hormone receptors, and also genetic tests to identify mutations that causes breast cancer. Surgery is the primary treatment of breast cancer. We have mastectomy, which is the removal of the breast. and lumpectomy, which is the removal of the tumor in the breast, leaving the breast intact. Health workers can also combine other therapies to treat breast cancer. We have chemotherapy, radiation therapy, immunotherapy, targeted therapy, and hormone therapy to treat breast cancer. Breast cancer is a treatable disease when detected very early. Awareness, screening, and timely treatment can save your life.